So for the next disease which we'll be talking about, that's importance of using cerebrospinal fluid for analysis. Next disease which we'll be talking about is cerebral infarction. Cerebral infarction. So for the cerebral infarctions, of course, everybody here knows what is a cerebral infarction. So a blood vessel in the brain is actually like blocked or something, So how can we be able to use CSF analysis to be able to pinpoint this condition? So for the cerebrospinal fluid analysis, it can actually provide valuable insight into what cerebral infarctions, that's ischemic strokes, So you can actually dictate what biochemical and cellular changes associated with what brain injury. So while imaging studies like CT scans, MRI, they remain the gold standard for stroke diagnosis, CSF analysis can also help. Okay, specific cases, maybe when the imaging can actually give you a clear stuff, or when you're now trying to access if there's like secondary stuffs associated with it, you understand? So now, what are the possible CSF findings, in somebody that has a cerebral infarction? Protein levels are elevated, so this is because there's neuronal damage and there's blood-brain barrier disruption. Increased lactate suggests that anaerobic metabolism is occurring due to ischemia. Xanthochromia, like the cerebrospinal fluid, is yellow. Alright, mostly at times if there's secondary hemorrhage, the pleocytosis, there's increased white blood cell count, the glucose levels are basically reduced to, So clinical utility, basically you're trying to differentiate ischemic stroke from hemorrhagic stroke. Also can assist in diagnosing post-stroke complications such as infections or maybe a secondary hemorrhage. Alright, may also be useful in cryptogenic strokes, where imaging findings are actually unclear.